Hello friends, welcome back to my YouTube channel. Today we are discussing about second part of mental health nursing, multiple choice questions and answers. Before that, if you are not subscribed my channel, please subscribe. We can see the questions and answers one by one. And the first question, the word psychiatry was coined by, and the options are Philip Pinel, Thomas Rennie, Sigmund Freud, Johann Ryle. The word psychiatry was coined by, and answer is Johann Ryle. And the next question, learned helplessness is typically seen in, the options are delirium, dementia, schizophrenia, depression. The learned helplessness is typically seen in, and the answer is depression. And the next question, thought block is characteristically seen in, the options are dementia, schizophrenia, depression and anxiety disorders. The thought block is characteristically seen in, and the answer is schizophrenia. And the next question, the brain tumor of which of the following lobe is most frequent cause of dementia? The options are posterior frontal, posterior temporal, anterior parietal, anterior occipital. The brain tumor of which of the following lobe is most frequent cause of dementia? And the answer is posterior frontal. And the next question, which of the following drug awarded in mood disorder associated with psoriasis? The options are carbamazepine, fluoxetine, lithium and nortriptyline. Which of the following drug awarded in mood disorder associated with psoriasis? And the answer is lithium. The patient with a pre-existing psoriasis will develop flare in the lesion on lithium treatment. So it should be avoided. And the next question, apart from having elated mood, which of the following is a typical sign of mania? The options are flight of ideas, pressure of speech, delusion of grandiosity and increased psychomotor activity. Apart of having elated mood, which of the following is typical sign of mania? And the answer is flight of ideas. And the next question, drug of choice for nocturnal bruxism is, the options are chlorpromazine, haloperidol, phenobarbital, diazepam. Drug of choice for nocturnal bruxism is, and the answer is diazepam. The nocturnal bruxism is a stereotyped movement disorder characterized by grinding or clenching of teeth during sleep. And the drug of choice of nocturnal bruxism is diazepam. And the next question, the following symptoms are common in anorexia nervosa except, the options are weight loss, dehydration, mood changes and menorrhagia. The following symptoms are common in anorexia nervosa except, and the answer is menorrhagia. And anorexia nervosa is an eating disorder causing people to obsess about the weight and what they eat. And the next question, which of the following is the common disorder seen with attention deficit disorder with hyperactivity? The options are suicide, cluttering, personality disorders, conduct disorders. Which of the following is the common disorder seen with attention deficit disorder with hyperactivity? And the answer is conduct disorders. And the next question, a speech dysfluency characterized by excessive rate and irregular rhythm resulting in the condensation of sounds and collapsing of words. The options are stammering, cluttering, stuttering and Wernicke's dysphasia. A speech dysfluency characterized by excessive rate and irregular rhythm resulting in the condensation of sounds and collapsing of words. And answer is stuttering. And the next question, the behavioral method used in the treatment of schizophrenia is, the options are contract therapy, response prevention, token economy, covert sensitization. The behavioral method used in the treatment of schizophrenia is, and the answer is token economy. The token economy is a form of behavioral modification designed to increase the desirable behavior and to decrease undesirable behavior with use of tokens. In this, the individual receives tokens immediately after displaying the desirable behavior. Then the tokens are collected and later exchanged for a meaningful object or privilege. And the next question, the behavioral treatment most useful in obsessional state is, the options are flooding, covert sensitization, response prevention, and token economy. The behavioral treatment most useful in obsessional states is, and the answer is response prevention. And the next question, thrombocytopenia is most frequently seen in patient taking. The options are chlorpromazine, haloperidol, Diazepam, and lithium. Thrombocytopenia is most frequently seen in patient taking, and the answer is chlorpromazine. And the next question, which of the following drug does not undergo any metabolism in the body? The options are fluoxetine, haloperidol, lithium, and Diazepam. Which of the following drug does not undergo any metabolism in the body? And the answer is lithium. And the next question, a neuroleptic drug without extrapyramidal side effect is, the options are penfluridol, thioridazone, flupentixol, and clozapine. A neuroleptic drug without extrapyramidal side effect is, the answer is clozapine. And the next question, first neurotransmitter discovered was, the options are dopamine, 5-HT, acetylcholine, and norepinephrine. First neurotransmitter discovered was, and the answer is acetylcholine. The next question, a form of persistent mood disorder with persistent mild depression is called, the options are euthymia, dysthymia, cyclothymia, and hypomania. A form of persistent mood disorder with a persistent mild depression is called, and the answer is dysthymia. The next question, presence of anxiety with severe motor restlessness is called, the options are agitation, ataxia, apraxia, and anhedonia. Presence of anxiety with severe motor restlessness is called, answer is agitation. And the next question, alcoholic seizure characterized by tonic-clonic seizure after a heavy hours of drinking occur usually within, the options are 3 to 4 hours, 8 to 10 hours, 12 to 48 hours, 48 to 72 hours. Alcoholic seizure characterized by tonic-clonic seizure after heavy hours of drinking occur usually within, and answer is 12 to 48 hours. The next question, obsessive and exclusive interest in one's own self is called, the options are narcissism, mannerism, negativism, and fetishism. Obsessive and exclusive interest in one's own self is called, the answer is narcissism. And the next question, flapping tremor is, the options are delirium, asterexis, akathisia, and dystonia. Flapping tremor is, and the answer is asterexis. The asterexis is tremor of hand when the wrist is extended, sometimes said to be resemble a bird's flapping its wings. So it's called as flapping tremor. And the next question, sexual arousal with enema is called, the options are clismaphilia, necrophilia, zoophilia, and coprophilia. Sexual arousal with enema is called, And the answer is plasmaphilia. And the next question, physiological and psychological phenomenon induced by the repeated intake of substance is called. The options are abuse, tolerance, withdrawal and dependence. Physiological and psychological phenomenon induced by the repeated intake of substance is called. And answer is dependence. And the next question, persistent involvement in the act of touching and rubbing against unsuspecting non-consenting person. The options are froteurism, masochism, fetishism and voyeurism. Persistent involvement in the act of touching and rubbing against unsuspecting non-consenting person. And answer is froteurism. 25th and last question. The physiological reversible reduction of conscious awareness is called. The options are coma, delirium, confusion and sleep. Physiological reversible reduction of conscious awareness is called. Answer is sleep. Thank you friends. Thank you for watching. Please subscribe my channel for more videos. Please like and share this video. Thank you.